What is the indication for thyroid scintigraphy with iodine, with 131 iodine? In which disease we prefer to make this study?
This indication, I didn't understand, Professor. Can you explain a little bit when we use this
indication? What is indication?
Yeah.
Indication when we perform this study, in which disease?
Okay.
Iodine scan is gold standard for follow-up of patients with differentiated thyroid cancer. After operation and after thyroidectomy, we perform iodine scan to follow up patients for remnant, for metastasis.
So in hyperthyroidism?
What?
In hyperthyroidism and so on?
In hyperthyroidism, we use a thyroid scan, but not with iodine, but with technetium to visualize nodules and to characterize the nodules. Are they hot or cold? Because the treatment is absolutely different. If the nodule is hot in thyroid scan, it can be treated with iodine. It is very effective treatment with iodine. But when the nodule is cold, it means that nearly 20% of these nodules are cancer. So if the nodule is cold, there must be operation and excision of this nodule.
Doctor, the iodine is used to evaluate the production of the hormone.
Yes, but what do you mean?
I mean that the thyroid absorbs the radioactive iodine and processes the iodine to make the thyroid hormones, basically.
Yes, but when it is trapped with 131 iodine radium,
you said
we use it for diagnosis and for visualization of the nodule.
Okay. It's most commonly used in the hyperthyroidism, as they said, as Vangelis said.
Yes, in hyperthyroidism, we use not iodine but technetium because the radiation is lower than in comparison with iodine, and the result is the same.
Professor, is this important now to know the half-life and the energy that is included in these substances?
No, not for all, but it is important to know the main of them. For technetium, for example, and for fluor, which we use to trap fluor glucose for PET studies.
Okay.
Do you know what kind of radionuclides we are using for therapy? What is the main characteristic of the radionuclides used for therapy? To obtain the result and to treat the tumors, we must use radionuclides which have high energy. And in practice, we use beta particles and alpha particles because they have high energy and the dose is very high in the tumor which we must treat and not in surrounding tissues. Okay. What we use when we use myocardial perfusion scintigraphy? In which diseases? In which patients? What is the indication for myocardial perfusion scintigraphy?
I think this was a nuclear stress test, right?
With yes, we use stress test before myocardial perfusion scintigraphy, but when? In which patients? In which diagnosis?
When the blood flow is insufficient.
Maybe in coronary disease.
No, it's
No.
not in.
In
Okay.
patients with ischemic heart disease.
Yeah, when the blood flow is
Coronary,
insufficient, is basically that.
Yes.
I said coronary.
But I don't hear you.
Coronary.
Before coronary artery.
Yeah,
Before.
coronary artery.
Before coronarography. We use it to diagnose coronary artery disease and to assess the patient if he needs coronarography or not. And in patients who have passed stent implantation, to follow up them, because very frequently they have restenosis of stent implantation. And it is a very useful method to assess the stent. And the third group of patients which we study with myocardial perfusion scintigraphy is to assess viable myocardium, because patients who had myocardial infarction and need stent implantation or bypass, it is very important to assess the myocardium. Is it viable or not? If the myocardium is viable, the procedure will be successful. But if the myocardium is not viable, the results with medical treatment are better than surgery. Which are the main clinical indications for performing PET-CT with FDG when we perform PET-CT?
In malignancies.
In tumors, yeah.
Yes, 80% of the PET scans are used in oncology. For what? What is the aim of the study? Not as a first method for diagnosis, but
to find metastasis, maybe.
yeah. The main reason for performing PET is staging, because we perform the study in whole body mode, and we can see not only the tumor, but its metastasis too, in one study only. So it is very important to perform PET-CT for staging of the oncologic disease. And not only it is very, very important to perform PET-CT after treatment to assess the result of the treatment. And in some diseases, we perform PET-CT after 2 or 3 courses of chemotherapy to assess the effect of the therapy and to assess if the patient needs another treatment, to change the treatment or to follow these regimens. And the third reason for performing PET is in follow-up patients after active treatment, because it is very sensitive and functional study, and we can obtain image of metastases before other methods, structural methods. So it is very important for oncology patients. Do you know what is Captopril test and when we perform it? In renal scintigraphy, when we perform Captopril test to diagnose renal vessel hypertension. It is very sensitive test to diagnose renal vessel hypertension.
Hypertension, stenosis.
Stenosis of renal vessels.
Yeah. And with contrast, or we are using this Captopril oral or with the contrast?
No, we perform renal scintigraphy with technician DPA and give patient Captopril, one tablet Captopril, to see how the function is changed after Captopril. If the function is worsening, in this occasion, we have renal vessel hypertension. You'll see the pictures in the lecture.
Yeah.
Oh, so I see that nobody has learned the lectures and has no idea for nuclear medicine. So, do you have any questions?
For now, no.
No. Okay. So I showed you what will be questions during the exam, and I believe that you will read lectures and can answer them.
We will be more prepared. Because we had, you know, Professor, we have some lectures and some tests, and we don't know what is going to happen with the whole situation.
Yes, I understand.
You know.
I understand that it is very difficult now, but
we don't know when it's going to be the exam. We don't know when we will come back. Today they told us to come back on 18th.
Yes, nobody knows.
We will start again. We don't know. We have some tests to do. We supposed to be on vacation, like holidays these days, and all of them comes up. We will be more prepared during the exam.
I believe that. I told you that I don't want to know everything. I don't want you to learn textbooks and other materials. I told you it is enough to learn the lectures and to know these very basic questions, not everything. But you must have what is nuclear medicine and how it can help clinicians in which indications can we use nuclear medicine methods to help clinicians. So,
Okay.
When the time comes, we will be ready, doctor. Don't worry.
okay. Professor Hadzidekov will give you the questions.
Yeah, we have.
Okay.
Yes.
Do you have any questions?
No other question for now, I guess. But if we have also your email, I guess, or we can ask for it, and we can ask some questions if we.
Yeah, you have my email, so don't hesitate. If you have any question, ask me.
Okay. Thank you very much, and
you're welcome. Be healthy.
You too. Have a nice day.
Have a
Bye-bye.
nice day.
Thank you.
Bye.